Namaste everyone. I am very glad to present this here. It is totally unfortunate. Actually, I was not supposed to present. I just came with my father to just accompany him for his presentation. And unfortunately, I met Anjaney Murthy sir, and he told me to present. And thank you, sir, for the opportunity. And this is just my thesis presentation. I studied in Kerala, my UG from Ahalya Ayurveda College, and my PG from SDM Udupi, and I am passed out on 2022. And this is our final year presentation. I am a Prasuditandra Sriroga MS, and I have done thesis on randomized comparative clinical study to evaluate the effect of Triphaladi Kashaya in Prasava. So, I know you are all students, all are BAMS, final years, or just to know, because
mostly final year.
Okay.
There are some second year.
Okay, because final years mostly knowing my subject, others maybe needed some more enhancement on that. That's why. So, in when you come for Prasuti Andhra and Stri Roga, either you should go for a obstetrician or for a gynecologist. There is two options, especially in Ayurveda. And everyone end up as a gynecologist. It is a fate because it is rarely practiced, obstetrics rarely practiced in Ayurveda. And I am one lucky person who got to practice in SDM Udupi. And we do deliveries like 5 in a day. So I chose my thesis on labor, and I have just, this is an introduction like Prasava Garbha Mochanam, like how we told in the Kudi Praveshika that Trigarbha is a like mother's womb. So from the mother's womb, the expulsion of baby from the mother's womb, that process is called Prasava. And that Prasava, how can make easier? It is the most painful process in a human lifetime. Everyone agrees that, right? So I have thought, my thought was just opposite to that. How can we reduce it? The normal labor time for a primary matlab the one who takes Prasava for the first time. So the primary is starting from 6 hours to 18 hours, and after 18 it will be prolonged labor. So I have thought that how we can reduce that, how we can reduce it to the minimum hours. That much long term pain which is sustainable by the human being, it is quite impossible, right? So upon that thought I came to this solution, that Triphaladi Kashaya. These are my objectives, like what I have told. What is the efficacy of Triphaladi Kashaya, and with the normal control. Normal control means the oxytocin group, which is normally used for the normal labor nowadays, and without that now very rarely the normal labor happens. And these are my thesis contents. Maybe if you are going to PG, you may be come across these things, like we want to show the source data and method of collection, like where do we take patients from and how much we are supposed to take. There is a criteria in research. We are supposed to take 30 patients at least. And if you are going for a study, it's better to do a comparative study. This is I am telling just for your future purpose. If anyone is going for PG, these are the criteria you are supposed to meet when you are doing it a thesis. Okay, so I have divided into two groups, one with normal labor, that oxytocin group, and one with my Kashaya, like thesis drug, Triphaladi Kashaya. These are the research methods we want to make in our PPT. And this is the slogan. This is taken from Sastra Yoga. Tribala Eshtiga Kwadam Neyumaya Parigiduga Adigam Novu Kudade Te Sude Putram Kshanadvadu, which means Tribala and Eshtimadu. Only 4 drugs. With that we will make kashaya. With the anupana of ghee we used to give to the patient, and which gives the result adhigam novu kudade. It is Malayalam mixed sloka because it's taken from Sahasra Yogam. Adhigam novu kudade means with not much pain, like the pain will reduce. And putram chanadvadu, kshanad putram, like the sudden result, the time duration of labor will decrease. That is the falasruti of this sloka. So when you are conducting a study, we want to take the falasruti first, and we are doing a research on that with authenticity of all research criteria. When we conclude, we want to claim how it comes, how the drug acts on that labor, how it acts on the patient, and the child is also our patient, so how it acts on the baby also. So for that, we want to discuss about the Rasa Virya Guna Vipakas. In that, you have seen like only 4 drugs is there, and all are rasayanas. Can you see that? All are rasayanas. Unfortunately, today we have a Kudi Praveshika presentation, rasayana presentation. So it is very easy to me to convey this. These are all rasayanas, and with those rasayanas, we can make the baby very healthy. With if it is a difficult labor too, we can make the baby out very easily. Okay, because the vipaka, if you see, all are having Madhura Vipakas. So with that Madhura Vipaka, it acts on the baby as well as the mother. And there is a, if you have studied Prasuti, you maybe have gone through the Garbhini Paricharya and the Prasava Paricharya, etc. In that there is a little conflict on this, on Haritaki, because Tribala mostly it is not applicable in Garbhavastha, but only after completing the term period. That is after completing the 37 weeks. So I have done my studies after completing the 37 weeks. So that is the main criteria. Like inclusion criteria is 38 weeks of gestation with primi gravida, and exclusion with pregnancy with complications, and pregnancy with a history of threatened abortion, BH, and malpresentation, systemic illness. Because when you are going for a study, you are not supposed to take any patient with the complications. And intervention was like Tribaladi Kashaya made like a Fanda Kashaya, Sudha Fanda Kashaya, like a tea. So we want to give it twice daily, 50 ml, and with the Anupana of Gogruta. The authentic Gogruta we want to give, otherwise there will be any side effects like Udgara and gas problems, so many things happens. And it is given twice daily in the Apana Vata Kala. And it was prepared like, I have made it like a sachet so that the patient can easily prepare. When you are going for a study, you should make sure the patient's accessibility to the drug and how the palatability also, and how she can make it. If she is supposed to make, and how she can make it easily. So you are supposed to make that drug possible for every patient who is coming under that criteria. I am just telling for your plus point if you are going for a study. So I have made it to sachets of 10 grams so that they can easily, like a tea sachet, tea bag, they can dip into the boiling water, they can boil it, and they can make the kwada and just keep down the bag and filter it and take it. Then after that she can easily take Anupana of Gogruta, like twice in a day after completing 38 weeks and till the labor starts. And when the labor starts, in the first stage we can give the same kashaya, but from the second stage we can't give, because second stage is almost the baby is coming out. The main parameters was the intensity of pain felt and pathograph, Bishop score, and changes of the duration of each stage of labor. And this was a scale especially developed for the labor pain. It's called Espadoppa scale. It is recently came into the under the WHO. So this is I downloaded from the WHO site only. This scale have developed only for labor, because the labor patient can't tell you how she felt. because she will be in that much pain. She can't tell anyone, she will be tensed, and she can't express also sometime. But with the little changes like body responses, like facial muscle responses and body response, there is a scoring. If you see this, there is a scoring 0, 1, 2, 3 like that, like increased or decreased. That is a it is not that much accurate. That's what I felt when I did my study, because not all patients have these responses. There is five more responses, that vegetative symptoms also there, like sweating and nausea, vomiting, dizziness and everything, because all those patients will not have the all symptoms. So the score will be returned to 0 sometime, because all those changes will not come to one patient. So that's I felt when I used to this scale. But in thesis it is necessary, we should study everything in under a one scale, proper scaling, because the research demands that. And progress of the study was, sample size was 15 with each group, and case registers, but I got so many cases because I was in a good college, and four cases were dropped because they were not able to drink kashaya, they were getting nausea feelings, so 4 cases was dropped. And clinically the observations are spontaneous rupture of membranes. I think you can understand that spontaneous rupture of membranes was the main symptom which I observed in the patients. They will come with the leaking, main complaints of leaking, PROM. So premature rupture of membranes they will come with, and they will admit, and within 2 hours labor will progress to 1 centimeter. That cervical length will increase by 1 centimeter within 2 hours. Mostly in primary it will increase in text it is supposed to increase in 2 hours only, but practically if you are going to an hospital, you will observe that it will not increase by 2 hours, minimum of 3 hours in primary. So I have observed with this kashaya, if you are giving in the first stage also, it will increase within 2 hours, and the duration of labor, it was reduced to 6 hours to 7 hours. It was an average, like all 15 patients in that 6 hours to 7 hours was the average period statistically, and the pain was, in statistics the pain was the same, but according to the each scale, I told you the scale, according to the scaling it was differed. And ekapado yamakule pada eka ihastida, that is the comparison or the example which is told by Kashyapa, that while the lady in labor, it is like one pada in Yamakula and one pada in Bhumi. That was the state of a lady, that you can't imagine that much terrible state the lady will have while she is having the labor. So in that stage, who is taking the action? Apanavada is taking the action. So we want to control the Apanavada so that we can have a controlled, normal and healthy baby and mom. So that was the criteria, and for that we need what? We need Vatanulomana, proper Vatanulomana, that which helps through the Tribaladi Kashaya. So that was the discussion, and this was the in the analytical study, tannins and LTG. LTG was the estrogenic compounds which helps that drug to induce the PGs and the estrogenic action, so that cortisol will decrease. Cortisol and estrogen have the vice versa action. So the mother will not be that much tensed, how it will be in the normal. Understand? If you have any questions, you can ask. Okay, so that was the ingredients in the analytical study. It will induce the labor and which will have a controls on the blood loss as well as the in the pain and the time. And after the PGs like prostaglandin emits, the time period will decrease. Prostaglandin are the golden like hands, how we will say golden hands that carries the baby. How we can explain easily. So with the prostaglandins, it will carry out the baby easily, that initiate the labor. So it will initiated by the LTGs, and giving birth should be like, it is a code, just simple code. So this was all about my study, and we have concluded that with statistically the pain was not decreased, but the time duration was decreased up to 6 to 7 hours in primary gravida. and others all things was normal, like baby and mother was normal, and blood loss was also not much. Blood loss was also controlled. So hereby I conclude my session.
Excellent presentation.
It's totally not prepared.
No problem. So, I also studied that just before, delivery, when the lab has started, we get Tesla Kashan Masti.
Yes. Yeah, this we can give as Vasti also, but for the patients like edibility, and Vasti will not be applicable for every woman. They will not appreciate that. We have done one more study in our college with Ishtimadu Taila Vasti, like Matra Vasti, and in that we have assessed that thing. Like everyone is not ready to take that Vasti at that time, because they will be going under so many stress and so many tensions. But so many people are there, they used to yeah, we will do it and we are ready to do. So many patients are there. Yes, Matravasti. After 8th month. Yeah, I like in the 9th month. Yes, Matravasti.
How many days?
For 7 days.
7 days.
Yes.
So I want to narrate my experience. So my experience and my wife's experience. So we did the proper Garbhini Paricharya and all the breathing exercises, and also administered Vasti also. And 25th March was my kid's delivery date, first child, I mean was. 24th night also she was walking at 10 p.m.
Yeah.
So until then there was no pain. Maybe in the middle of the night, 2 o'clock or 2:30, she woke me up and she asked me that she is having the feeling of going to motion again and again. She was still not aware that the lab has started. My mother was experienced. She said, no, we have to go now. So we took her in auto to district. So we studied somewhere that we should not lie down. So she was walking all the time. The doctor was not in arrived. We went to the hospital at 5 o'clock in the morning. And actually she said, no, we will go after sunrise, maybe 6 o'clock we will go. But my mother forced her to go by 4:30. We started to reach the hospital at 5. Then the nurses asked us to lie down, The doctor is very non-person. So he said, no, we will walk. We gave the Tripla Kashaya Vasti also. They will give Pilsen every month. Instead of that, we gave Tripla Kashaya Vasti in the morning at 5 o'clock. Then she was walking. Nurses were like very unhappy. The doctor has not arrived. Till 5:45 in the morning, she was walking. And doctor came, nurses complained to doctor, see doctor, this lady is walking. Then the doctor said, it's very good, she walks. Then 5:45 she entered inside the operation theatre, and I was also with her, holding her hand. And 5:51 the delivery happened. Maybe she lied down on the table for only 2 minutes or 3 minutes. And after that the delivery happened, she said, what? That's all? You are asking me that's all? Really came out? Really? So,
yeah. I had a similar experience with 2-3 my patients. They were admitted in the hospital itself because it was in the COVID time. My thesis was also on that time. So once they are admitted, then they are not supposed to go back out. Only after delivery they are supposed to go back. Like that, there was one criteria. So with the same criteria, I have implemented the Kashaya with them, because anyway they are under observation, no any other medication. So I have taken them to my thesis, and we have observed the same thing. Like around 12:30 in the morning, like 10 o'clock, I have given the Kashaya, like before food, and she came to 12:30 just for the checkup. And the baby's head was almost came. We randomly took her. She didn't told anything. We randomly took her. Okay, we'll check how the dilatation is, because anyway she is under observation. So we'll see. It is about to come. After feeling the stomach, I felt that okay, something is about to come. Like that I thought, and I took her. And by 12:30 we examined, and the baby was there by 1. Baby came out. Yeah, so there is so much like if whoever follows the correct diet and the proper time of medicine. Proper time of medicine also one important factor. That person will used to get the time duration very less. That's what I observed through my studies. That time, Aushadha Kala is very much important, and Anupana. We should give proper Anupana. So, in the first trial period, I have suggested patient to take Gogrudha from outside, which was not at all good. Then we planned to give from our own farms, and I exported to Udupi. Then we have given like that. So it was very much variation. So much variations happened in symptoms as well as in the labor time.
The quality of Gurda,
Yeah, quality of Gurda, Ishtimadu.
All these things matter.
Matters.
We usually think of Bipla only, but still Gurda only. But if the best quality Gurda is given, we will get best.
Yeah, it matters. It is there.
So this statement is like very important statement for all the women. Yes. It should not be the greatest fear. They should cherish these memories, and Ayurveda can definitely help them come out of their greatest fears and cherish the whole process. Thank you so much for taking this project and helping so many women. I hope you will help so many thousands of women in your future practice.
Thank you.
So much. Sir, would you like to we should start earlier.
Yes, because the term period should complete. That's the time when baby accomplishes the full growth.
This past is present is future tense. I don't know about future tense, what is going to happen tomorrow. I am hoping Saint Mother's lecture. All the lectures that we have shown.
I have taught Kuti Purashika Rasayana. Maybe I have taught Kuti Purashika Rasayana for more than 30 years. Studied each word, each akshara, word by word. But what is going to happen? There will be lot of gap between theory and practice. But he has kept this practice alive. Suppose he was not doing this, it will be like we have what is called as Gagana Kusuma. Gagana Kusuma, we have not seen Gagana Kusuma. Gagana Kusuma, example Gagana Kusuma. How should we tell this? He is having one practical example, and people are going and getting good results. So ultimately, you are studying Kuti Purashika Rasayana, but when you are going outside the college, you are talking to father, mother, relations, what is this Kuti Purashika Rasayana, how this can happen? You can go to Seta Madhavan sir in Kerala, he is doing this, he is getting good results, means they will shut their mouth and keep quiet. No? Because people will ask so many questions about Ayurveda who have a model of Kuti Purashika Rasayana. So I bow my head to his feet for doing this. But ultimately what should happen is, I have requested him and I requested one of my friend from Industrial Ayurvedic Center. Yes, please come here, please. One very secret transaction took place between myself and Sir and him. He is going to, he asked his permission. Sir, can I come to your place and stay for 7 days and study this Kuti Purashika and all these things? Sir told immediately yes. Correct?
Yeah, immediately he told that please come.
Yes.
That's all. Yes. When I were also almost 2 years. Yeah, also.
So when something is happening, some secret things are happening elsewhere. They are looking at these things, no? Like a clock is moving out, inside so many things will happen. Some very good things have happened. So that if you can tell about Ayurveda, what is happening in industrial Ayurveda.
So before I want to tell about Ayurveda, I just worked in Ayurveda retreat Kulu, Tamil Nadu. So I almost worked 8 months in Ayurveda. As one and only doctor and handling everything. So I am not comparing any hospital to anything, but comparing with I just work and I just saw the one essence or one thing different between these other hospital and Ayurveda means SOP. which is standard operating procedure. So I just saw an advertisement about Ayurveda that East Indus Valley. They were a doctor, like resident doctor. So I just went to HOD and I had the interview. So before that, the interview, everything is over, and they just gave me one book. It's called, I just told you about the SOP. And they told to study is completely the standard operating procedure, which completely followed by each and every, even from the sweeper to doctors, they are completely following that. And they not only giving me the theoretical knowledge, they send me with the therapists. The therapist courses are going on with them. And I have 8 to 9 months of experience. Not too much, I know that. But they send me. They send me and they are giving me the complete vision with all the treatments which is particular happening in their institute. So I one of the surprising 2 years before I just know that the main brain, one of the brain, so many people are there, and one of the brain was our Murthy sir. So it makes me more inspiring. So what is the answer? Surprise about it. So at the first day, for the meditation sir, you can ask about how to start an initiative completely. So please include this point about like SOP. If you are starting any initiative, just make a plan from when you want to start, how you want to end, how you want to go systematically, just not the word systematically. So I think you can run an institute later. That's all. Thank you. Thanks.
You may be wondering why you may be wondering why I am calling him, what is happening. He started talking about Kutipurashika and suddenly some person is coming and talking about something. Learning about everything is important, but at the same time, learning the dangers of that also is important. My teacher told, Upayam Chintayan Prajnaha Apayamapi Chintayet. Very, very important is think about dangers that will happen. Are you following me? Suppose you are new person, you pass BNs, you pass MD, whatever it is, to some danger happens, you are afraid. Right? But if you take care what type of dangers will come and take adequate precautions, dangers will not come. I repeat this sentence, Upayam Chintayan Prajnaha Apayamapi Chintayet. So now what has happened in this Indus Valley Ayurveda Center, I am very much fond of this particular thing. From morning 8 o'clock to 6 o'clock, was sitting non-stop in front of the board, and one person from JC Engineering College, very standard engineering college, is coming, who is expert of ISO, Indian Standard Organization, ISO. Every point, what should be done as Puru Karma, what should be done Pradhan Karma, what should be done Kasar Karma, is written. Unfortunately, we go on preaching, but we don't practice. I have seen all colleges in Karnataka and India who teach Svedana Yoga. But at no place in Svedana Shiksha, medicines required for Svedana Yoga are kept. Suddenly, person gets Svedana Yoga, maybe 1 in 1 lakh. Wherever you are going to run from one place to another place, it is not possible. So, my request is, if you are going to open this Panchakarma theatre, have medicines ready for Svedana Yoga. That is one thing. Second thing, one condition called as Rasayana Vibhamsha, which has already been told. Some person asked, what should we do with Rasayana Vibhamsha? Clear cut guidelines are there, follow that particular things when Rasayana Vibhamsha takes place. So I was telling Sattogala people who are able to do this particular things, many people run away also, but he is doing this pariksha. Only one point what I observed is, so there is some link between the father and daughter, I feel. Because he is talking of Trigarbha Kuti and madam is talking of Garbhashya. That also has 3 layers, no? Garbhashya is also having 3 layers, and Sir is talking about Trigarbha Kuti. Some relationship between father and daughter, both are sitting by the side, and you are also talking of good delivery, and Sir is also taking up good things. Why this Kuti Pravashika is so important? If you understand the significance of Kuti Pravashika, you will leave all other things and go behind Kuti Pravashika. Because I am telling, whether it is President of India, President of America, or Prime Minister of Japan, everyone wants to live younger. Everyone wants to live longer. Everyone wants to live longer and younger. What is the use? A person is 90 years, he cannot see, he cannot hear, he cannot show anything, we don't want. But that person wants to live younger and live longer. Okay. Poor people come to you, very rich people come to you, Ambani and Adani also may come to you. So when the Ambani and Adani comes to you for 24 hours, is there any limit for the charges? No charges. So whatever 100 lives you can earn, in one life you can earn. Lot of experiments have been done behind this sign. Thousands, millions of experiments have been done, but many of them are failures. Already people have done that. Kuti Pravashika is the ultimate solution where person can remain Deepgamayu, Smuti, Meham, Arogyam, Varatveha, Prabhavarana Sarozarem, Dehendra Balamkaram, Vaksiddhim, Pranatim, Kantim, Labhatena, Rasayanam, Shastanam, Rasayanam, Rasayanam. And final word is Shastanam, Rasayanam means what is Shastata? Prashastata. What is Prashastata? Qualitative, quantitative, better rasa are the dhatus. Can you imagine? See, even if after 1 million years you can't change the definition. Biochemistry may change, physiology may change, so many things. He is using one ultimate Shastanam, Rasadinam, Dhatunam means Prashastata, best thing. Then he is using Dirghamaya. So, Vaksiddhi, you know the meaning of Vaksiddhi? Can anybody tell? What is Vaksiddhi? He ultimate person. I am asking the students, Vaksiddhi, one word. In Rasayana, Vaksiddhi word has been told. What is the meaning of Vaksiddhi? Yes, whatever he talks, it is going to become happen. Number one. Number two, he knows his limitations. Sundar will tell, sir, you conduct one camp in Vizag for 100 patients of retinal pigmentosa, and he'll got a very good sister. Yes, both of people accepted and they're going to do it. Vaksiddhi. So people don't promise unnecessarily. They know the capacity of doing, and when they tell it, they'll do it. That is Vaksiddhi. Pranati, what is the meaning of Pranati? You should understand, each word is important. Pranati means local Ayurveda. No, all people will start falling at his feet. And automatically, Pranati, local Ayurveda. Everyone responds. Who doesn't want this? Tell me. Kanti, Lasha, people, okay. All these things are going to happen. Show me in modern pharmacology anything equivalent to this. Any medicine is there? Nothing. I will give another million years to this pharmacology people. Come anywhere near to this people. They cannot come near to the professional side. In Sharada Samhita, if you look at the Deepika, Guda Deepika comment, saying go and look at it, he is telling some yogas are there which are to be specifically given at Kudi Pravashika. Some yogas are there which are to be given specifically at Kudi Pravashika side. Are you following me? I requested the sir, is anybody doing Droni Pravashika? Droni Pravashika, have you heard of Droni Pravashika side? So he has got Droni at his place, he has built a Droni out of separate, that is separate chapter. But you read Droni Pravashika side. Have you read Droni Pravashika side? Anybody? Droni is a boat. In that boat, detailed techniques are there. I don't want to go behind it. Sir has got Droni Pravashika side. As today's context was Kudi Pravashika side, I just want to tell you that he has got a Droni at place and you can study about it. Why are you worrying so much about this? Two things are there. My date of birth is 5351. But I run, I jump, I do so many things. I am 73, maybe I am walking like a 50 years old person. Maybe I am grey hair, that's but I am walking. So one is called as biological age, another is called as chronological age. We cannot change date of birth. We cannot change chronological age. We can change biological age. So by taking Kudi Pravashika, a person who is age of 60 years, we are not changing his date of birth. But when he is coming out, his cells will be having the age of 50. Understand two things, biological age, chronological age. By Kudi Pravashika, what is going to happen? We have changed the biological change. Cells will be looking in there. Thousand things are there. Free radicals, you can look at the telomere length, so many things are there behind this. I don't want to go behind it. Ultimately, people are telling with Ayurveda we cannot earn money. You can earn millions and millions of dollars by Kudi Pravashika. I will stop at that level. Millions. But understand it properly. We thank Dr. Sundar. We thank Dr. Sundar for bringing such a noble person here. And another thing observed, he was sitting by my side, he was taking full video camera of his daughter. It's a mobile hand, mobile is kept with a steady hand. Not even 1 millimeter it is shaking, but maybe he's also taking Kuti Purashikarasan. I don't know what he has done. We should understand the secret. He's holding it steadily. What is your age, sir? Age.
मेरा एज क्या आपको बात मालूम?
Maybe like 60.
69.
69. Oh, very nice. At 69, he's keeping a steady hand. So he is the role model for the Kuti Purashikarasan. So, like father, Dr. also is equally great. We immediately I saw her presentation. Don't curse me because I pushed you into this particular stage. Why I pushed you means here young brains are there. So you will be like an inspiration. You will be like a role model. Lifelong you will remember. I came to this place. I never heard this place. I never dreamt that I am going to come place. But at this place you have heard. You have told this to me. Maybe this name is, what is your name? Manisha. She will meet you after 20 years. You are somewhere. She will tell, Madam, you gave a lecture. Now I have become post-graduation in Prasul Tantra Stiroga, and she will fall at her feet. So you have become a role model for so many people. So we thank you, Madam, for doing wonderful presentation. I'll just tell 2 or 4 sentences to complete. My one student who was doing BMS in Government Ayurveda College, Mysore. She was having poliomyelitis. So she used to walk limping in first year. I told we'll do Abhyanga and Shashik Shalipendaswela. Wonderful results, sir. Abhyanga Shashik. So we did Abhyanga Shashik Shalipendaswela. Her faith in Ayurveda increased. She did BMS, then she went to Trivandrum. She did her post-graduation in Prasul Tantra Stiroga. After she came back from Trivandrum, I asked, what did you learn? What are you doing? Sir, in our college, we are doing some wonderful experiments. You have studied Langali. No, Langali. If you tie the roots of Langali, easy process taking place. So they have tried Langali. They have used this Langali as a belt-like thing, and process is taking place. But what is happening when they are using this Langali? Wounds are happening over the area. How to prevent wounds? They are preparing Langali ointment, Langali Dhruta, and applying over the Azolavi. Then easy delivery is taking place. This is experiment done at Trivandrum. We should understand this. Similarly, in Kalavarishra Ayurvedic College, Bangalore, one is called as Pikisa. All post-gradual mark is going to occur. If you apply Lodra during the antenatal period itself and then during the postnatal period, Pikisa can be avoided. In the previous USSR case, one magazine used to come which is called as Sputnik. They have mentioned about underwater delivery. Maybe Madam can throw the light afterwards. Underwater delivery, they are telling, as baby is in water, if the baby is allowed to be delivered in water, baby sustains better immunity, better capabilities, and there are a lot of research. Okay. Now, tribal people are very worse. Near Mysore, in Bihar Hills, there is a tribal locality called as Solika tribes. They do delivery in the standing position. Can you imagine? And standing position delivery is better. Solika people are still doing the delivery in the standing position. So, Krishno hi loke buddhimatam acharya, shatruschapi abuddhimatam. Krishno hi loke buddhimatam acharya, shatruschapi abuddhimatam. You want to be buddhimatam or you want to be abuddhimatam? You see, for all us, there are great gurus who are learning great things. Thank you very much.